of all, I'd like to ask your permission to use this video
Yes.
for educational purpose on the internet. Tell me about your symptoms before the surgery.
Most of my symptoms were my lower back and my hip, my
Do you
inner
like to
groin.
show me where the pain was before the surgery?
Right here
Yeah,
and
okay.
in the inner groin of the hip.
Yeah, if you don't mind to show it one more time and
Right
put
here.
your thumb where the maximum pain used to be. Okay, I see that.
Right on the
Okay.
waistband.
And then you said as well the groin.
In the groin, the
Okay.
entire groin.
Okay. Now please have a seat. Now, how bad was that pain?
It was intense. There were times I'd have to use crutches because it was so bad.
How long did you have that pain?
Since my last hip replacement, so probably 2 to 3 years.
2 to 3 years. Now, how was your daily activity with that pain?
I couldn't do a lot. I couldn't bend over, couldn't tie my shoes. Had to lay down after work for at least an hour every single day just to get rid of the pain.
Yeah, and you did a lots of non-surgical treatment and they weren't helping. Is that
No,
correct?
I have a spinal cord stimulator, injections, physical therapy, all traditional methods did not work.
Did not work. How did we find out what the problem was?
Came in, did a CT scan, and that was it. You showed me the pictures.
Yeah, but as well we did some specific tests, right?
Yes.
What did we do? What do you remember?
I believe it was a lot of movement and almost, what was it, like positioning of like the leg, like the chicken wing, I guess.
Yeah, we tried to provoke it and then it was positive, meaning when we provoked your sacroiliac joint, we found out that sacroiliac joint is the problem.
Yes.
And then we confirmed it with some injections. Do you remember the injections?
Yes.
They're not pleasant, are
No,
they?
like a discogram. Those are awful.
But what were we looking for in those injections and what was the results?
Well, we were looking to see how much of a percentage of positive results of pain, decrease in pain to be able to then have it surgically fixed.
Yeah, and I describe it to my patient, it is like, what the dentist put in your gum and start rolling. Now, imagine the dentist put the numbing medication on the right and drill on the left.
Oh, no thanks.
It wouldn't help you, right?
No.
So meaning that if that's not the location where the pain is coming from, those injections would do nothing for you.
Right.
But if 75% of the pain repeatedly goes away after that injection, even for a fraction of a day or so, then we know at least that's where the pain is originated. Right. If pain is gone while numb, then that is where the pain is originated. But as well, some people mistaken that this is supposed to make the pain go away indefinitely and so on. Imagine the dentist numb it today and come back and drill tomorrow.
No.
That won't help you either.
No.
So meaning that the effect is temporarily, but your results were positive, meaning that you confirmed that's where your pain is coming from. And correct me if I'm wrong, but we did that for both sides, correct?
Yes.
So you had problem on both sides.
Both sides.
This is what we did about 6 months ago. We did a Trident sacroiliac joint fusion, and the good news is here that with the Trident, I have to go only one pass through your tissue and put all 3 screws through the same path, and the screws are perfect. They are exactly where they are supposed to be, and if you look carefully, inside of the screw bone is beautifully growing. Outside of the screw is still pending. It still has to work on it.
Right.
So we did the surgery only on the left side.
Only on the left.
How is the right side?
The right side is good.
So
it fixed both.
Focus both, and that is, you remember we talked about that 50% of the cases, we have 2 sacroiliac joints. If it's a problem there, you either use one or another. But if you fix the worst side, sometimes half of the cases, 50% of the cases, we don't even have to go fix the other side.
Right.
It seems that it was
I got
the
lucky.
case. Yeah. Now tell me, after you remember the surgery?
Yes.
Tell me about after the surgery, how the symptoms were.
I had 0 hip pain in my left side, and the pain in my back was gone. Instant, as soon as I woke up.
Yeah.
It was just a different pain from the surgery.
Yeah. But what about the right side?
Right side is good too.
It's good too.
It takes a little bit longer, but it's just waiting for my body to adjust to the surgery.
But you told me something that I think our patient needs to know. That you said you have the feeling that you're sitting on a metal.
Yes.
Okay. And here's the metal. This is the metal you're sitting in, and your tissue will build some tough membrane scar around it, and eventually you'll get used to it. But here is that the metal you feel you're sitting on, and you just described it very well without really knowing what it is, but you described it very well. So when we get about a year out of the surgery and the other side still not bothering you, These become less likely. In my experience, probably less than 10 to 20% chance that we need to fix the other side. But it's not 50-50 anymore once we are 1 year out.
That's good.
So meaning that there's a good chance that we don't even have to touch the other side ever in the future.
That's good. I like that.
Yeah. So overall, so far happy with the results?
100%.
Now, obviously, we use this method, this Trident method, in the with other system. Every time we pass through the buttock to get there, we have to to put 3 screws. We have to put 3 passes. Then you would feel that feeling in the buttock more,
Right.
because then we poke 3 times there, and those pokes are not small; they are
No.
big one. But with Trident, the advantage is that we pass it only once, and the third and the second screw, they go through the same sleeve, and then they change the angle.
Right.
So we don't have to poke you. You know, every time you do that, it's like putting a slug, shutting you in your buttock with a slug.
Yep. But I was able to walk without crutches after only like a week and a half.
Good, good.
With full comfort.
Yeah.
I mean, it was really quick.
Excellent, excellent. No, well, this is a very good result. It's still healing, So, but what we tell to the patient, what do you remember? What we told you? Not how long to use the crutches, not crutches, the walker and so on.
I only use crutches.
Yeah. Okay.
A week to 2 weeks.
Yeah. Usually we say 2 to 4 weeks, but people usually know when they are ready for it.
Yeah.
Okay? So,
I would start forgetting to use them because it felt so natural.
Yeah, and that's good. If you see that the patient, limitation we put in place is just the estimate, but healing is individually different. So meaning most of people know when they are ready for it.
Yeah, and my body was ready to go.
How long did you take pain medication?
Well, related to the surgery, not long.
Yeah.
But I have other issues that caused it. But I was able to get off within like a week.
Oh, excellent. Well, thank you so much for the interview. I think that's very helpful for my future patient.
Good.
Really appreciate that. Thank you.
You're welcome.